most famous physical therapist on the internet.
Hello, I'm Brad Hennick, physical therapist.
Hi, I'm Chris the Pharmacist.
And I'm exactly one half of the Bob and Brad Physical Therapy channel. Today we are extremely happy to have Chris here to complement and upgrade our show. We've got some very good information that's going to be helpful for you as well as for me personally about Alzheimer's. And we're talking about
Treatment.
Treatment you can do medically as far as medications that are offered, as well as what you can do without medications that can help hopefully slow the disease process down and help out your loved one or your friend, whoever you may be interested in helping with. So before we go on any farther, we need to go to Chris because I'm going to relax a little bit.
All right. Well, I guess we're going to talk about Alzheimer's today, and it's more about the treatments. And so basically, Alzheimer's is the most common form of dementia worldwide. So we're talking about 60 to 70% of the patients. In the U.S., you're looking about 5 million patients.
Wait, 60 to 70%
of Alzheimer's or dementia patients have Alzheimer's.
Oh, I see. Okay.
Yeah, I mean, yeah, and then the next one is Lewy body, and then there's vascular dementia, temporal frontal. There's several forms of dementia, and if we think about it, like I said in the last video, kind of an umbrella. But we're going to talk about Alzheimer's because I think it's the most
prevalent.
Yep. So
and do you have some? You said there's more women typically have it than men.
Yeah, kind of interestingly, just from a statistical standpoint, it affects women more than men. So women, the ratio is about 1 in 6, which is about 16%, and men it's 1 in 10, which is about 10%.
Okay.
So of the population may experience that. And again, with Alzheimer's, it takes 6 years just to get the diagnosis because we have to rule out several different things. It's going to be whether your medications are causing it, had a head injury, mini stroke. I mean, these are things that we have to be aware of.
And it seems like oftentimes early on, especially, memory is the biggest symptom of Alzheimer's, but it can be symptomatic with other things as well. So that's why it's hard to define what it is.
I mean, when you're busy and you just, where'd I put my keys? I have no idea. Why are they in the bread box? It doesn't make sense. Not that I really use a bread box, but...
But like I mentioned, I literally put my socks in the refrigerator, and I don't think it was a symptom of Alzheimer's. Is because I was thinking about what I was doing.
You were thinking about everything else.
At 1 o'clock in the afternoon on that video, and I was trying to get lunch, all that kind of thing. So again, it's not easy to diagnose, but it's something to...
And that's what makes it so tricky for doctors and neurologists to actually diagnose it. So there's a variety of tests that they kind of go through. One of the simpler things that's done that's inexpensive is the SAGE test. So a big fancy term, self-administered gerocognitive examination. It was done by
SAGE. And this is something that you could print off the internet?
I printed that right off the internet. It's from the Ohio State University. So
I could print this off. I could take this home and do it with my mother tonight.
Yep. You bet. It takes about 15 minutes. And then basically you can present that to your doctor. And then basically, as scientifically you could, probably do it about a year apart or 6 months apart. So you have an interval to see if there's any decline going on. And you don't have to do the same test all the time, although scientifically it's probably going to be the best.
Sure.
Because then you'll see.
You can compare
it.
Historically how things are going. And I just want to say, if you do this, for example, I know with my mother, she would have a hard time reading this because of her vision, so I would help her. And some of these questions on here, I would probably have to explain to her a little bit about it so she understood it, and that's okay. You just, you can make little notes on the back so that later on, 6 months later, you kind of know where you're at.
And sometimes you can even set this up so that it's part of your appointment. So let's say you're going to be seeing neurology. You do the test right before you go in or as you go in, and then the doctor will grade your results, and then they'll get at least a baseline.
Sure.
So this is something that's inexpensive. It requires just a printer and some pencil and some paper, and the paper's right there. So it's something that's nice that you can definitely do, and it doesn't cost an arm and a leg. Whereas a PET scan is an expensive test.
Sure.
So, but when we come down to it, they're going to do a cerebral spinal fluid test. They're going to do PET scans to see what's happening in the brain. I mean, Alzheimer's is caused, what we think anyways, is by, these amyloid proteins and these tangled tau proteins. So that seems to, if you think about our brain, it's a network of nerves. And then when we get these damaged tau proteins, it's kind of like if I took a bunch of spaghetti and dumped it on the table and tried to make order out of it. And those brain signals don't necessarily communicate properly.
So they get mixed up.
They get mixed up. So if you're trying to follow one noodle and all of a sudden you're looping and so it's the same thing with the way that your brain fires. And so what do we do? Well, I mean, we can certainly eat well. We can exercise, try and stabilize sleep, but there's medications that we can try and use. And there's not a lot of them out there, so it's a pretty short list. So you have cholinesterase inhibitors, and then you got the glutamate.
So there's two medications commonly used?
Well, the two that I most commonly see in the pharmacies that I work in are going to be donepezol and then memantine. So, and they behave differently, but you can, there's galantamine and rivastigmine, but
keep it simple.
Yeah, but we'll use those two because those are the most widely prescribed drugs, and sometimes they're used separately, and sometimes they're used in combination with one another.
And the physician decides.
And usually when do you do this? Well, we've found that the earlier you get on these medications, the better, because again, no cure, like we talked about, but it does put the brakes on. So instead of it coming down sharply like this, it's going to be a much more angled thing. And so what does that do? Well, because we know that the average caregiver spends about 5 hours a day with a patient, it may allow the patient to become a little more freedom, a little bit more independence, and maybe allow, and maybe time occurs where something miraculous does happen. There are a lot of things in the research pipeline right now that they're discovering. There's a new, very expensive drug that at least it's out on the market. It's very expensive. It has not been proven to work. It actually got the emergency authorization, kind of like the COVID vaccines, but we're not going to go in that direction. But it got out on the market a lot sooner than it normally would. I mean, the ultimate results of this drug are not going to be fully processed till 2030. So it's 2021 right now. Yeah. So that kind of tells you it's a very embryonic, process with learning whether this drug that may inhibit, it's called algae-home. But
because it's so far in the future, can we take can we go into, you mentioned about food and diet.
Yeah.
And I'm thinking,
and
as a saying, well, let's look at the diet, because I was looking at some of this, and as opposed to just good food, let's be more specific, like you're going to eliminate or cut down on processed foods. Sugars.
Yep.
The big one, get those darn sugars out. And yogurt has as much, you can buy a yogurt and it has as much sugar in it as a can of
soda.
Pepsi, yeah.
Yep.
Or Coke, whatever.
Yeah, but
So you really got to read the labels on what you're eating, because sugar is in everything is processed. Sugar and a bunch of, the fat, the bad fat, trans fat. So, boy, get after the food and do the bad. It doesn't matter. It's going to make the person's body healthier, even if, in theory, it doesn't help the mind. It's a good thing.
Yeah, I mean, it's going to do all over it. I mean, really, the time for this is probably now. You don't want to wait until you get to that point to just get started with healthy habits. I mean, if you're young enough, start today. I mean, really, one of the simplest ones that I liked, the Mediterranean diet. If you guys Google the Mediterranean diet, it's got a perfect blend of proteins and healthy fats and nuts and things of that
leafy
nature.
Greens, so it's spinach.
Exactly.
Yep.
So it's going to give you that type of diet and pretty flavorful food, to be honest with you.
I know. I just heard one thing. It was, and I've heard this and read about it in books. Is the color of food indicates
eat the rainbow.
Yeah, so you got your berries, your raspberries, blueberries, blackberries, all these berries and nuts, and you're not going to overeat them. You're going to eat, a handful or whatever, and that's enough.
Yeah, I mean, you're going to have the flavonoids. They're all antioxidant, which seems to show, and there's actually quite a few books now that do show that by eating well does help to slow the progression of the disease. So again, it's going to be healthy for you whether you have, I mean, you're talking about 1 in 10 or 1 in 6, male or female. So not everybody's going to get it, but eating well is still something we should, strive for every day anyways.
If it's going to help your heart for sure.
Yep, exactly. And that's actually, when you look at all the lists of things, cardiovascular disease and cancer 1 and 2, Alzheimer on cause of death is number 6 for over adults. So it's something that and so what happens is, again, it progresses from mild to severe. but along the way, when we get to those milder stages, and probably earlier, is when we want to get on those medications.
Sure.
And so whether it's donepezol or it's, memetine, I mean, those are things that they work differently to help brain transmission, processing memory. But I will tell you with donepezol specifically, which is a cholinesterase inhibitor, so for all you pharmacy nerds out there, that raises the neurotransmitter acetylcholine. And as our brains diminish in capacity, it helps to keep those levels up to allow them to fire longer. But eventually, that reservoir does run dry. So sometimes then they will go to the memetine, which works on glutamate, which is a different neurotransmitter. And actually, the brain seems to kick out too much. So what the memetine does is it kind of blocks that, so it leaves just the appropriate amount of glutamine in there. Again,
so you're trying to get things balanced
so
in the
you
brain.
you can connect your thoughts, and you can stay in the moment a lot more easily. And so these drugs do have an avenue, and they seem to work best right now with current science in the milder stages. We might find that with more advanced testing, which they're working on, that we might see that maybe being prescribed younger and younger. If they're, we might just take some blood from you, Brad, and just say, yeah, we're going to look at this. We got these 3 genes here that suggest that maybe there's a possibility.
Right.
Preventatively, maybe they do it. So hard to say. There's a lot. There are just burgeoning amounts of research going on day to day right now. So it's not that there's a lot of different treatment things. It's so it's going to be staying well. And in your arena, physical therapy. I mean, what can we do to keep those muscles strong, to keep us walking safely?
And really, I mean, you don't have to go out and do a 5K. These people are typically older. That's not appropriate anyways, but just some walking, whether you need a walker or a cane to stay safe, because falls, obviously we want to eliminate that risk.
Absolutely.
Memory things. I just want to say there's some things, if you do have a loved one, they're walking fine, but they may forget how, like where my mother lives, she has issues. It's possible she has Alzheimer's. If you forget how to get to the dining room. So you're going to walk with them multiple times so that hopefully the repetition is going to kick in. The brakes on a walker, the 4-wheeled walker. We've done a lot of things in skilled nursing facilities like this. In big letters, we'd make it bigger than this. But remember to lock your brakes. And we would tape this right to the walker so the person can always see it. That repetition is one of the things that can help so that people can remember and make them safer. Hang up the phone, talk on the phone, Some people these older people don't have cell phones.
Correct.
My mother would be, she's got to have something she can hang up, but she forgets to hang it up and it just beeps and there's a problem. These are just examples. Again, all these little things that you can do to help slow the process down, keep your loved ones safe.
Yeah, it's going to be, getting rid of clutter, keeping things organized. Whiteboards and big checklists or calendars are an excellent non-drug tool that honestly have probably almost more utility than even some of the medications at some point. So, I mean, it's...
throw rugs, man. That's a therapist. A big thing. Get the throw rugs out because they're one of the biggest fall trip hazards there is in a house.
Absolutely. I mean, head injury, hip injury, you name it. Whatever can happen in a fall. If there's a coffee table, you probably want to lose those too. I mean, it's just so that we keep things out of the way.
And that can be a tough one because some of like my mother, there's some things we ask her to do and she says, nope.
Yeah, well,
I've been doing it for all my life this way, and I'm not going to change, and that's just the way it is. So that you have to kind of dance around.
That is true, and you do. You have to find, pick your battles. I think is probably the, and so. But whatever we can do to de-stress, declutter, help around the house, pay bills. I mean, auto pay, financial affairs in order. These are all things that are part of the treatment mechanism. And so those are things that you can certainly do. And with the last video, and I think we should attach to this one, we'll put some of the websites for support groups that you can go to if you're a newly diagnosed patient or a loved one that has a newly diagnosed patient in your family.
Right.
I think those are excellent support avenues for you to explore and to learn. And I think knowledge above anything is power.
Sure.
And it's going to help us to kind of go forward and go through this journey as safely and as effectively as possible.
Exactly. And just to finish the video out, because it is a progressive disease, if they definitely have it, there's going to be a point where you are unable to care for your loved one or friend. And it's going to be a time that they're going to have to go to a facility where there's professional care, 24/7 assistance to make it safe for them. And that can be a real battle as well because the individual oftentimes does not want to leave their house.
Nope.
You don't want to make that decision for them. It's a very challenging,
It's
difficult.
knowing when to punt is a
yeah,
hard question
it's
to ask yourself.
tough thing to work with, and hopefully you won't have to deal with that. But sometimes it goes smooth. I know with my mother it went smooth. She was happy actually to go to this place. She's social. This is another big thing. You have to be social, get that interaction. Isolation can be one of the
It's
big problems.
I think it does. Yeah. So anything you do stimulating, games, talking, walking, anything you can do to stimulate the brain, all good stuff.
That's right. All right. So these are some ideas. Again, look below the video. There will be some options, books you can read, other sites, websites that you can go to for further information. So very good. Good luck with your friends and family who may have these problems. Thank you.
Thanks, everybody.